now going to move on to guidance around Lloyd George's. So NHS England have now confirmed that if a patient's paper medical record has been successfully digitised, then you can destroy the Lloyd George, but you must do so securely. Now, if a patient is transferring to a home nation, so if they're moving to Ireland, Scotland or Wales, for example, a practice will still need to print out the record because the GP to GP file transfer won't work for those types of records. So a practice will need to print out the full medical record if the GP to GP transfer has failed, which it will if they're going to a home nation because it doesn't work for those. And if you are a digitised practice and are required to print a record for sending and no longer have the original Lloyd George, then you can simply just create a new one for that record that you do need to move. Now, this query came up quite a bit in the last webinar, and it kind of applies the same for any babies that have never had a Lloyd George. You can simply print the record and create a new Lloyd George in order to send that record manually. If you no longer have any Lloyd Georges and you need to order some additional, you can just do that through PCSE Online in the supplies area, as I've previously shown you. Now, again, in the last webinar, we did have people asking why the full record needs to be printed and why it can't be emailed over. And that's mainly due to the email files that can often be too big and then records are incomplete when they're being sent over. And sometimes we find that images aren't sent over correctly and things. We just need to make sure that the quality of the record and the full record is sent to the new receiving practice. And we just need to make sure that the new practice receives it in full at the best quality. Okay, so I'll now discuss printing digitised records. Okay, so when a patient moves from an English GP practice to a Scottish, Welsh or Northern Ireland GP practice, as I've previously mentioned, the GP to GP transfer will not work and the files cannot be sent in digital formats. So basically, GP to GP transfer won't work outside of England and vice versa. Now, labels will automatically be sent to your practice when a record needs to be sent to a home nation. Now, when sending patient records, the English GP will need to check the transit label to see the documents are leaving England and then print out the full paper record and use the Citisprint delivery procedure. Now, when sending physical patient records to another GP practice, you've got to make sure that you print the records in full and ensure that the notes are clear for the receiving GP practice to be able to read them. Now, where a practice copies and pastes multiple pages onto one page, we often find that that results in the patient record being difficult for the receiving GP practice to read. And then sometimes in some instances, the original records can no longer be retrieved. So it's just really important that the quality of the records that you are sending in manually are in a good standard. So just make sure that they're all separately and they can be easily readable by the receiving practice. Now, if you need to identify a label that's for a home nation, you'll see that it's got the abbreviation just in this area. So you've got SCO for Scotland, which is also available here as well. And then you've got Wales and Northern Ireland. So once you are satisfied that you need to print and send a label, you can just print the full record and bag it as you would with any other record movement and send it within your next Citisprint delivery. So there are some other occasions where a full patient medical record would need to be printed, and this will be if, for example, if a GP to GP electronic transfer fails, when the stop ID shows all those abbreviations I've just mentioned. So you've got Scotland, Wales, Northern Ireland, I think there's Isle of Wight on there, and sometimes it will also say PCSE, which would indicate that it's going into PCSE central storage. And then you've also got ARC, which is going to archive. So when you do receive a label, it's just good practice to just check those areas to see if it does need to be printed and sent with your Citisprint delivery. Okay, so what to do if a GP to GP transfer fails? Now, GP to GP transfers can fail for many reasons, and in these scenarios, records do need to be printed in full. And the reason for that is that the patient may not be registered with a new practice, and the records need to be sent to PCSE central storage. Now, PCSE can't accept emails of records, we can't accept CDs or USBs, etc. We can't read them, so we can't accept them. So please don't send them. Please just send out the paper record. Now, practices using version 2.2a should integrate the received electronic health record promptly within 8 days. If not, the previous practice will automatically be notified at the end of day 8 that A, the record has not been integrated, and B, that the paper copy of the electronic record should be printed to send with a Lloyd George envelope to the new practice. Now, if you do need any further information about that, you'll just need to contact NHS Digital, and I've put the web address at the bottom of the slide there for you. Okay, so I just wanted to put a slide in about this because it was a question that we received either from the last webinar or a part of the invites of this one. There seemed to be a bit of a theme around it. Now, the question was about practicing receiving blank Lloyd Georges with a letter to state that the record has been digitised. And apparently on some occasions, the record hasn't been saved. And when the receiving practice has contacted the practice that has sent the records, they've just been advised to contact PCSE and they were wondering whether that was the correct course of action. So if essentially no, because PCSE don't have access to digital records. We have no way of checking any records that are electronic. Now, if the previous practice details are known, we ask that you contact them. Otherwise, do contact PCSE with the details and we will try and get that rectified for you. If you are contacting PCSE, we ask that you send the patient details such as NHS number, name and date of birth so we can support you the best way we can. Okay, so just to stress on this one, because I know it is a very common issue with regards to the movement of medical records, we just ask that you do not send any CDs or USBs or emails of medical records. They can be damaged in transit or easily corrupted, which will then essentially could mean that we could lose the data on those files. And not every organisation can access CDs. And also USBs or CDs may not be safe to add to clinical systems. And sometimes we found that when documents are sent, they've got passwords on them, which means that the receiving practice can't access it. When they've tried to contact the leaving practice, the staff member that have created that password has sometimes left the practice, which then essentially leaves the note that nobody can access the notes. So all electronic health records must be printed and sent with a hard copy using your PCS tracking label. Okay, so unfortunately, if a GP fails, then the only option is to print the record and forward it to the new practice. So, and PCSE aren't linked to any clinical systems. So again, we're not able to view those. Okay, so I appreciate I've just gone through quite a few slides there. So I'm going to hand you back over to Ian, if that's all right, just to highlight if there is anything that I've skipped through, anything that's coming through on the questions that you might need to clarify.
Thanks, Debbie. Quite a few queries around the use of the contact us form in terms of, do we need to send them all individually? No, definitely. If you've got multiple patients who've labels you haven't received, definitely send them all in one form. It's easier for you, it's easier for us. Got patients who haven't ever been registered with you, but you've got their record. That could be you've received from another practice incorrectly, done a clear out of your cupboards and find a load of records stuffed away which are no longer registered. And there's a page on PCSE online under the records tab called movement request, where you can just go in there, put the patient details in, and that will create a transit label to be sent to you. Quite a few queries about digitised records in terms of what you need to do if you've been digitising records. We're actually in the middle of a project with NHS England where they're asking us to essentially stop sending transit labels to practices who have digitised their records. At the moment, labels get sent regardless of whether you've digitised your records or not, and both us and NHS England have identified it's a bit of a waste of transit labels being printed when there's no record to be sent. So we are working with NHS England to stop that happening. No action needed from anyone at the moment. We'll essentially be getting a list of practices who digitise their records from NHS England. We'll then be updating that into our system, which will essentially then stop those records needing to have a transit label printed. There will still be some caveats to that. So where patients are moving to home nations, so Scotland, Ireland, Wales, where they don't use GP, so we'll still need to print that out. Likewise, if the record is going into archive, again, the transit label will still need to be printed. So there's some caveats in there for why we would still need to be sending transit labels even if you digitise your records. A few queries about kind of the details and contents of what's on GMS1, GMS3s. that is actually outside of our remit, and we're not responsible for what is on those forms. So we've had a few queries from practices saying they're receiving GMS3 forms and it's just blank, it just says the patient's name, that's it. We don't have any control over what a previous practice puts on there. So if you are getting that, you need to raise it either with your clinical leads or with your ICBs. They'll effectively go via NHS England to get in contact with the previous practice, but that's outside of what PCC will be responsible for. A few queries again around Lloyd George's and whether they can be securely destroyed once you've digitised your records. So if the records have been digitised and stored successfully, then yes, the paper records can be destroyed. However, if GP to GP has failed, then the digitised record will still need to be reprinted and put into a new Lloyd George. And as Debbie mentioned earlier, if you haven't got the blank Lloyd George, you can order those through the supplies page as well.